we've had to make a number of adaptations on critical care because we look after a number of different types of patients.
When the COVID-19 pandemic first started, we realised based on worldwide experience we needed to very quickly change how our hospitals worked. What it means for patients is that we've separated our hospitals into distinct zones. A red zone, where possibly patients who have COVID-19 are managed, and green zones, where we know that there are no COVID-19 patients are being managed. So when patients come to the hospital, for example at the A&E department, they'll be directed to the most appropriate area. We'll assess them and make a decision whether we think that potentially they could have COVID-19 or not.
Hello, my name is James. I'm a healthcare support worker here in the emergency unit, and welcome to the COVID tent.
Staff will be wearing personal protective equipment, so please don't be scared by that.
And you'd walk through here.
We may take your temperature, we will take a history from you and then direct you to the appropriate area. So if you were to come to the hospital for a planned procedure, we will give you specific information prior to arrival. You'll be told to self-isolate. We also will probably swab you in the days before the procedure to ensure that you don't have COVID-19. When you come to the hospital, there will be specific guidelines and there's a specific pathway that you follow. For example, you may all be asked to ring a doorbell and wait in an appropriate area and be brought into the department and follow a specific pathway into the department and a different pathway out of the department. The critical care environment is where we manage our most unwell patients. Our staff are highly trained and know exactly how to manage you should you have to come into that area.
If the patient is having aerosol generating procedures, then we will be fully donned with full PPE, and if it's a non-aerosol generated procedure, then we'll just be wearing a surgical mask, aprons, gloves and a visor. So if either you or a loved one have been told that you're going into critical care, please be reassured that we're putting all measures into place that we can to maintain both your safety, your relative safety and that of the general public.
If you're coming into hospital for a planned operation, then it's highly likely we'll ask you to self-isolate for 2 weeks before the procedure. When you attend the operating theatre, we will take more time. If you are going to have an anaesthetic, you may well be anaesthetised within the operating theatre, which we appreciate can be a scary environment. But we assure you that this is safe and everyone is there to ensure the best for you.
So if you follow me, we'll introduce you to the one-way system and show you how this works for us.
If you are attending the hospital for an outpatient appointment, we appreciate that sometimes you may well attend early. Unfortunately, we can't let you into the hospital until your appointed time. What we recommend, therefore, is that you bring fluids, a snack, something to read if you are going to sit in your car. When you do come into the hospital, we will screen you. That may well involve us taking your temperature, asking you some simple questions, and then if we think it's okay for you to come into the hospital, we'll ask you to follow a pre-designed route to make sure it's safe for you. What I want to do is to reassure you, our hospitals are very safe. Over the past 4 months, we have worked really hard to maintain that safety. That means the hospital environment is somewhat different to what it has previously been, but we have pathways, we have appropriate zones, and our staff are incredibly well trained. I would like to also reassure you, if you have any form of disability, we have considered that to the utmost degree, and it is still incredibly safe for you to come into our hospitals.